And this is an ECG complex. One cardiac cycle, we have a P wave, QRS wave, and a T wave. And we will look at this one by one in details. This is a normal sinus rhythm. As we said before, the impulse is actually initiated from the sinus node through the atrium to the AV node, and then the bundle branch, and then to the ventricle, resulting in a synchronous contraction. And the impulse formation in the SA node, which is in the right atrium, and then resulting in atrial depolarization, which corresponding to the P wave. So the P wave actually represents the atrial depolarization. It is the rapid depolarization of the atrial myocardium. It is upright and rounded in inferior leads. Normally, it is 2 to 3 millimeter high and 0.06 to 0.12 second wide, and it precedes each QRS complex in sinus rhythm. And then the impulse goes into the AV node. There's usually a delay in the AV node, giving rise to a PR interval. And the conduction through bundle branches causes further delay. As is shown here, this part of delay is probably represents the conduction through the bundle branch. So the PR interval actually is the beginning of the atrial depolarization to beginning of the ventricular depolarization. It is usually 0.12 to 0.2 seconds. The duration may be shortened when heart rate increases or when there's presence of accessory pathway. And the duration will lengthen when heart rate decreases or there's conduction disturbances. And then the impulse will go down through the Purkinje fibers, and then to the ventricle, resulting in ventricular depolarization. And this is corresponding to the QRS complex. So the QRS complex actually represents the ventricular depolarization. It is a rapid depolarization of the ventricular myocardium. Normally, it is 0.05 to 0.1 second wide and 5 to 25 millimeter high. As shown here, this is the Q wave, this is the R wave, and this is the S wave. Then it comes the plateau phase of repolarization. It's corresponding to the here of the ECG. The ST segment actually represents the ventricular repolarization. This is a junction at the end of the QRS to the beginning of the T wave. It represents the beginning of the ventricular repolarization, and it is usually isoelectric. But displacement may be related to ischemia, injury, metabolic abnormalities, or drugs. Then it comes to the final rapid, so-called phase 3 repolarization, which is corresponding to the T wave. So T wave here represents the ventricular repolarization. It represents the repolarization or recovery period of ventricles. Normally, it is not more than 5 millimeter in limb leads or 10 millimeter in precordial leads. For the QT interval, it represents the ventricular depolarization and repolarization. It represents the total time required for depolarization and repolarization of ventricles to occur. And it varies with age, gender, and range from 0.35 to 0.45 seconds. Usually, or roughly, it will be 1/2 of the hour to hour interval. As shown here, the QT interval actually measures from the start of the Q wave to the end of the T wave. Sometimes you can see a U wave. What is it? It is a positive deflection after T wave and before the next P wave. The voltage should not be more than 50% of the T wave, and usually it is of the same polarity as T wave. It may represent Purkinje deep repolarization. As shown here, this is the U wave. The heart, the conduction system, also under the influence of the sympathetic and parasympathetic nervous system. As you can see here, stimulation of the parasympathetic system may stimulate the cardioinhibitive center, and also it is subjected to the influence of the sympathetic systems. Now, when you look at the ECG paper usually looks like this. Here, if 1 second will represent 5 large squares, and if we take 1 large square, that is here, the total time is 200 milliseconds. That means 1 small square is 40 milliseconds. This is important when we like to calculate the rate of the rhythm. So, about reading the electrocardiogram, we have to note the intervals. Let's recap the different intervals. The PR interval is the time from the starting of the P wave to the starting of the R wave. And the QRS complex duration is the starting of the Q wave to the end of the S wave. For the QT interval, it measures from the start of the Q wave to the end of the T wave. So there are some normal ranges in milliseconds, which we should remember. The PR interval usually ranges from 120 to 200 milliseconds. For the QRS complex, it's usually 60 to 100 milliseconds. And usually, for normal QRS, it's certainly less than 120 milliseconds. For the QT interval, it usually ranges from 360 to 440 milliseconds. When we read the ECG, we like to know the rate. How to calculate the rate from the ECG paper? The EKG measures time like clocks. So the clocks keep time in seconds. The EKGs reflect time in milliseconds. So for the clock, 1 minute, we have 60 seconds. For the EKG, 1 minute, we have 60,000 milliseconds. So when you write to convert the bit to minute to millisecond, if the heart rate measured in bits per minute, then you divide the rate into 60,000 milliseconds to calculate the rate interval. That is, the 60,000 milliseconds divided by the rate will give rise to the rate interval in milliseconds. Or alternatively, if you want to change from millisecond to bit per minute, then you divide the pacemaker interval, for example, in millisecond, by 60,000, and you get the rate. Let's look at an example. So how far is this rhythm? So if you measure the milliseconds between the RR, the millisecond is 860 milliseconds. So what is the rate? If it is to be divided by the 60,000, so 60,000 divided by 860 will give rise to 70. So the heart rate is 70. Let's look at another example. For this rhythm, how fast is it? If you measure the milliseconds between the two RR, that is the RR interval, it measured about 440 milliseconds. So the rate would be 60,000 divided by 440, so equal to 136. So the heart rate is 136. I usually use more easy methods to calculate roughly the rate. So I usually just count the number of large squares. For example, the large square between these two RR wave is around 1, 2, 3, 4, so around 4 large squares. So I divided by 300. So 300 divided by 4, so the heart rate will roughly 75. And I find it's quite useful if you just want a rough estimate of the heart rate. So when we analyze the ECG, it is important to look at the rate, the rhythm, and also the site of the dominant pacemaker. The configuration of the P and QRS complex is also important. And especially when you see an arrhythmia, you should ask yourself, are there normal-looking P waves? What is the relationship between P wave and the QRS complexes? And are there normal-looking QRS complexes? These questions are important to answer if you want to find out or elucidate the exact arrhythmia. Lastly, it's very important to remember, treat your patient, not ECG. All rhythm interpretation must be correlated with condition of the patient.